Good afternoon, everyone. I'm Dr. Deepak Agarwal, Professor of Neurosurgery at All India Institute of Medical Sciences, New Delhi, India. And I want to thank Indo-Indians and especially Ms. Poonam Sagar for giving me this opportunity to present our idea. And I'm going to be talking about digitization without data entry. So before I actually talk about the topic, we all know what are the issues facing us across Southeast Asia. Our hospitals are overburdened and there are a huge number of patients waiting in the clinics as well as in patients for whom digitization is very difficult. Also, there is lack of IT infrastructure and difficulty in maintaining mission critical IT services as well as infrastructure. The traditional solution we have all looked is having high quality electronic medical records, hospital information system, PACS, networking, etc. However, we all know it's a Herculean task maintaining all this cost effectively. Recently at AIMS in our institute, we had a ransomware attack and more than 10,000 systems were down for more than a month, and it exposed how vulnerable we are when we try to digitize anything. And that really made us pivot and think, what if we could do digitization without having in-house computers, without any data entry from doctors and nurses, without local area networking. And this is where we hit on the solution that mobile phones with mobile data provide. And I'm going to take you to our own ICU inside AIMS, and you can see there is a lot of structured, unstructured data, like from the patient monitors, from the ventilators, from patient notes, nurses' notes, which is not accessible to us, which is unstructured, and we can use all this data using machine learning and AI just by taking photographs of all these things like the monitors, the patient notes and other data. And this data, after we have taken a photo with the phone, can be converted into structured data by using image capture and image processing. This we have already done and shown on a pilot scale at our institute, and it has been hugely successful. You can also take photographs of CT scans of videos and again upload it using a similar method into a structured system so that it is accessible at all times and at a click of a button. More importantly, every patient's data is available to every healthcare provider. We also had a startup by the name of GoodMed collaborate with us in transcription of prescriptions, so that every prescription had a photo taken and sent to the central server where it was transcribed, first digitized and then converted into a local language, which was Hindi in our case, and sent back to the patient. So we were keeping a digitized copy into our EMR as well as sending back a local language translation to the patients. To conclude, digitization is possible in resource constrained and high volume healthcare settings. However, we need to use innovative solutions like those provided by GoodMed to really make digitization a success for countries like India. Thank you so much.